I'm Alex. I'm here to talk about kidney cancer so you don't have to. So, first off, who discovered the kidney cancer and when was it discovered? In my research, I haven't found any discoverer of this cancer, but I know that this cancer has been here since we have learned writing. We have found cancer from ancient manuscripts, mummies, and also ancient bones that has a bone tumor in them. And what happens to the cell? Well, the cell actually goes out of control here, because normal cells, they usually die off, but this cell, it doesn't, and with it, it just keeps multiplying and multiplying, and that's how we get a tumor. And also, where does this kidney spread? First off, the most common is renal cancer, and it usually stays in the kidney, but there are times where it can spread to the brain, the bones, and lungs. And how many types do we have for kidney cancer? There's at least 20 types of kidney cancer. And what are the effects of this cancer? Well, there's blood and urine, there's weight loss that you don't know what's the reason of it. There's also a cold, there's also a fever that wasn't because of a cold or an infection. And the sudden loss of appetite. The environmental or health factors that can cause kidney cancer. Smoking, male, obesity, advanced kidney cancer, and a long-term medication. Can the cancer be inherited? Yes, but it is very rare, only 5% of the time. And also, how can we stop getting these cancer? Well, there's many things such as quit smoking, having a healthy body. There's the first one actually ties to the second one, which is stop eating high fats and lean more towards vegetables. Medication, surgery, lifestyle choices. There are many ways to solve kidney cancer. Usually people would just do surgery, but you can also use radiation and chemotherapy. What tests are done? Well, there are many tests. One of them is as simple as taking a blood test, and the other one is where you put a tube through the bladder into the ureter and into the kidney. Done with MRI, CAT, PET, X-ray, or ultrasound. You can use MRI, IVP, CAT, and X-ray. Electromagnetic waves that if you use it in imaging, you can see the insides of a person. Which uses radio and electromagnetic waves. It is mainly for organs, torn ligaments, and tumors. X-ray exams, which they put materials to check their bladder and uteruses. CAT, which uses X-ray to picture bones, organs, and tissue. Okay, who's at risk of this cancer? Actually, there are many people who are at risk, which has 2 to 3 times much more higher chance of getting this cancer. Surprisingly, African Americans, who has a much higher chance of getting kidney cancer, and there's a link towards cancer and obesity. There's also people who are 50 to 70 years old, which has a higher chance of getting this cancer. How common is it? Actually, kidney cancer is quite rare. Only 200,000 cases in the US. So, what was the mortality rate? Well, first off, we had to go for the 5-year group. How many people survived the cancer when it was diagnosed? Actually, kidney cancer has a low mortality rate with a 75% chance of survival. So there are many factors that can come into this, such as if the cancer spread through other organs, then it will be 69%. and if the cancer spreads from its starting point to a farther off section of the body, then unfortunately you only have a 12% chance. Recovery slash remission rates. If you go to the 5-year plan, then it would usually be 75%. And what are the new experiments that we are doing for combating this cancer? Well, there is also targeted therapy and immunotherapy to advance kidney cancers. Targeted therapy is to target the genes that makes the cancer grow by using certain types of drugs. Are there any experimental treatments that we're doing? There's one thing called sapanisertib, which is basically used for metastatic kidney cancer. These things are to patients that have gone through treatments. Sapanisertib is a cancer blocker, which can stop the cancer from growing. Immunotherapy is a type of treatment that helps your immune system to fight off a disease, usually by strengthening affected and mutated. Well, there is a VHL gene, which basically, if one person has that kind of gene, it might mutate into clear cell kidney cancer.